Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about the pain puzzle, unraveling why we feel it so differently. Pain is personal. Pain is a universal human experience, yet its perception and impact vary dramatically from person to person. It's not just a physical sensation, it's a complex interplay of biological, psychological, and social factors. Psychological influences on pain. Previous experiences with pain, past encounters with pain create a template. Severe or poorly managed past pain can amplify current sensations due to heightened fear and anticipation. Positive experiences can foster resilience. For example, a traumatic dental visit in childhood can make routine cleanings painful as an adult. The meaning of pain, the interpretation assigned to pain significantly alters its impact. Pain seen as a sign of serious illness is more distressing than pain viewed as temporary or purposeful. For example, post-surgical pain is tolerated better when understood as a normal part of healing versus a sign of failure. Attention. Focusing intensely on pain can amplify its perceived intensity and duration. Conversely, distraction or shifting attention away from the painful stimulus can reduce its perception. For example, catastrophizing about a headache makes it feel worse. Engaging in an absorbing activity can lessen its impact. Depression. This can significantly lower pain threshold and tolerance. Altered neurochemical pathways, for example, serotonin, involved in mood also modulate pain. For example, chronic back pain feels more debilitating to someone experiencing depression due to reduced coping and amplified focus on discomfort. Anxiety, fear and apprehension heighten pain perception by triggering the fight or flight response, increasing muscle tension and activating neural pathways that amplify sensory input. For example, dental phobia. Behavioral and cognitive factors, coping skills, the strategies an individual uses to manage stress and emotions directly impact their ability to deal with pain. Effective coping, for example, relaxation, distraction, reduces distress. Poor coping, e.g., catastrophizing, avoidance, exacerbates it. For example, a chronic migraine sufferer using mindfulness meditation may reduce headache intensity, while someone catastrophizing about knee pain might experience greater disability. Sense of control. Believing one has some control over their pain, its cause, or its management can reduce perceived intensity. Feeling helpless amplifies suffering. For example, patients with patient-controlled analgesia often report lower pain due to the empowering sense of control over their relief. Social and cultural factors. Culture. Cultural norms, beliefs, and expectations influence how pain is expressed, perceived, and tolerated. Societal teachings shape internal experience and outward demonstration. For example, some cultures emphasize stoicism, leading individuals to show little outward distress despite severe internal pain. Social support. A strong social network provides emotional comfort, practical assistance, and validation, buffering pain's impact. Isolation can exacerbate pain and distress. For example, a patient with strong family support post-surgery may report lower pain and better recovery than an isolated individual. Gender. Research suggests gender differences in pain perception, tolerance, and prevalence of chronic pain conditions influenced by hormones, neurobiology, and socio-cultural roles. For example, conditions like fibromyalgia are more prevalent in women, suggesting potential physiological differences in pain processing. Fatigue, physical and mental exhaustion deplete coping resources, making it harder to manage sensory input, including pain. It can lower pain threshold and tolerance. For example, migraines can be more severe when someone is sleep deprived or overworked, as fatigue reduces their ability to cope. Differences in physiology and pain threshold, inherent biological variations in pain receptors, nerve fibers, and neurochemical profiles, such as endorphins, affect how pain signals are generated, transmitted, and modulated. For example, individuals having varying pain thresholds, meaning some perceived pain at lower stimulus intensity than others due to unique physiological makeup. The interplay of factors, a holistic view. It's crucial to understand that these factors do not act in isolation. They constantly interact, creating a unique and dynamic pain experience for each individual. For example, a person with chronic pain, physiological, who is also depressed, emotional, lacks social support, social, and catastrophizes, cognitive, will likely experience much higher levels of suffering than someone with similar pain but strong coping skills, a positive outlook, and good support. Implications for pain management. Recognizing the multifaceted nature of pain is essential for effective management. A holistic approach often includes medical intervention, addressing physiological causes, psychological therapy, CBT, mindfulness to address thoughts, emotions, and coping, physical therapy, improving function and reducing physical limitations, social support, encouraging a connection and community, lifestyle adjustments, managing fatigue, stress, and promoting overall well-being. Conclusion. Pain is more than just a sensation. It's an experience shaped by our biology, our minds, our emotions, and our environment. By understanding these diverse factors, we can approach pain with greater empathy, develop more personalized and effective treatments, and ultimately improve the quality of life for those living with pain. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel. Thank you again for listening.